All right, welcome back everybody to the brain injury discussion. This is your host, Jay. Today we're going to talk about anoxia and hypoxia. We're also going to cover the anatomy and what causes anoxia and hypoxia. And this might be a little bit longer than usual, but there's a lot of good information here I want to cover. Like always, the sources will be in the description below. We'd appreciate it if you give this video a thumbs up or a like. Feel free to interact with us in the comment section down below. We love hearing your feedback, and also subscribe to the channel so that you'll be uh, subscribed to the weekly informative and also educational content that we put out. But with that being said, let's get started. We need to talk a little bit about the healthy anatomy. So this ties in with ABCs. So if you've ever done a CPR class, you'll hear airway, breathing, and circulation. So you need an opening for the air, which includes the mouth, nose, and throat. You'll need the breathing, which is the lungs and diaphragm, where the carbon dioxide and the oxygen gets exchanged. And then you'll also need the pump to carry the blood. And so that involves some plumbing. So um, for those in the HVAC or the plumbing profession, some of this might be familiar to you because this is body plumbing, this is anatomy. So all cool stuff. But let's go a little bit deeper into this so we can talk about each section individually. So the airway is usually divided into upper and lower airway, just like some people have upper and lower respiratory infections. But the airway is, as we see here, the upper, which includes the pharynx, the larynx, and the trachea. So kind of this opening area into the trachea here, that's the upper airway. That has to be patent and clear. That's kind of like where the air comes in, and that's where the air comes in. So we inspire or inspirate, or we exhale. And that's the opening and passage needed for that. You also have the lower airway, which includes the bronchi and the bronchioles, which is what comes off of the trachea and goes into the two lungs. And the bronchi, which are the big branches, and you have the bronchioles, which are the smaller branches that go into the different lobes of the lung. So all of that is interesting, but we got to cover the breathing. The breathing. So you have two lungs, or at least in most cases, you have two lungs. You have left and right. The left lung has two lobes, and that is because the heart is in between the right and left lung, but it actually sits more to the left. And the right has three lobes. So if someone says, "Hey, I, had an issue with a lobe of my lung," you can ask them which lung it was. But then again, this is talking about the lungs writ large. This is just a very basic overview. What we see is that the oxygen and the carbon dioxide exchange happens in something what's called alveoli. And the lungs should not be seen as two big sacs. In fact, they're more like sponges than anything else, with a bunch of small little holes that the air gets in, and that's where the exchange happens. All of this would not be possible without the diaphragm. The diaphragm is this muscle right here, and when it pulls down, it draws air into the lungs, kind of like a vacuum sucks the air. So the diaphragm, when it lowers itself on the anatomical body, it's pulling that air from outside in. And the same thing goes with expiration. Which, when it relaxes, it pushes the air out. And so that's what's enabling me to talk to you guys in this video today, is because I have a working diaphragm. And so that is a very basic overview of the lungs and breathing. But we couldn't really talk about this without talking a little bit about the plumbing, the pump, and the circulation. What we do know is that this is called the cardiovascular system. So again, we break down that word. We have the heart, my very poorly driven heart, which is here, as well as the vascular system. So all the pipes and tubes and plumbing that takes the oxygenated blood throughout the rest of the body. The cardiac organ is the heart. That is the pump. And we do need that pump to work. And that pump does have to carry, push the blood through the arteries. The arteries is what carries blood from the heart or away from the heart. They're under pressure. So if you check your pulse on your neck, you'll feel that, okay, you can feel the pulse of your heart, or maybe you check it on your wrist, and you feel the pressure there. That's so the arteries are under severe pressure. The veins, however, are a little bit more elastic and they carry blood to the heart. So the veins actually have a series of one-way valves that prevent the blood from just working with gravity and going to your feet. But when we talk about the cardiovascular system, we should also talk about capillaries. Capillaries, much like alveoli, is kind of the reverse, really. Capillaries is where the oxygen and the nutrients and all the vitamins and everything, that's where it gets dropped off. And that's where the carbon dioxide and all the waste product gets on the blood so it can be transported around the body. And so the capillaries is where you want the blood to go. And it goes there by the way of the arteries, goes to the capillaries, delivers the oxygen, and then returns via way of the veins. And all of this needs the heart because that is what pumps the blood to and from the lungs and to the tissues. And so this is a very basic overview. That's why in CPR they teach you a little bit about the ABCs. You want to keep the heart pumping. That way it pumps that blood that is in the system. But with that being said, we need to get in that hypoxia and anoxia. What is hypoxia? What is anoxia? Well, if we break down the words, hypo or hypo is low. So think about hypoglycemia. Um, hypo is a lower or insufficient state of oxygen to the tissues. Now, anoxia is the absence. So we break that down. A, which is none, oxia, no oxygen is to the tissue. So it's a total absence of oxygen. Now, each of these examples could be taken both as hypoxic or anoxic, depending on it. But hypoxic usually, okay, so if you're in carbon monoxide or there's gas poisoning, there's some oxygen in the air, probably. Maybe there's insufficient breathing. Maybe you're not getting enough airflow through the lungs. That could lead to hypoxia. But if someone is fully choking, that means that there is no air coming in, thus it is an absence of that. Same thing with drowning. Even though there is oxygen in water, it's not in the right form or the proper scale to actually sustain life. So you need air, not water. Both contain oxygen, but what we find is that with drowning, it's a complete absence of usable oxygen to the tissues, which leads to a state of what's called apnea. If someone is apneic or apneic, that is a state of not breathing. So that is the difference between hypoxia and anoxia. Hypoxia is insufficient. Anoxia is a total absence of the oxygen. So moving on, what can cause hypoxia and anoxia? Well, hypoxia, we have circulatory hypoxia, which is kind of a body system thing. Think about those vasculatures. Think about the maybe insufficient oxygen that is being exchanged in the lungs. Think about someone with a history of lung problems. Maybe they were a smoker for 40 years. Then you also have insufficient ventilation, hypoventilation, which is a mechanical problem where you see that, okay, maybe you're not getting the air back into the lungs. And so this could be more, instead of just a vascular problem, maybe this is a lung problem. We can see this happen with COPD, chronic obstructive pulmonary disease. Think about that smoker who's been smoking all their life, 2 packs a day for 40 years. But we also have airway obstructions. Maybe think about those extremely swollen tonsils. Maybe think about, um, maybe someone has something stuck in their throat that could cause that insufficiency. And then we have the air oxygen deficiency. So think about the environment. That's where we get the carbon monoxide, carbon dioxide poisoning, and other breathable gases. Think about what's in there. Maybe smoke from a fire. All of that can cause hypoxia. But maybe we need to go further. Let's look into anoxia, which is the total absence of oxygen. We have some mechanical causes to include the pump, which is the heart is stopped. Think about your heart attack and myocardial infarction, which is a total pump failure. Your heart stopped. The blood that's there is not moving. It's not getting to the tissues. The tissues are starting to die. We also have environmental causes, so outside forces. Again, think choking, full occlusion of that airway. Basically, there's no oxygen getting in, no carbon dioxide getting out. It's just stuck. There's no oxygen changeover in the lungs, and that can be very serious. That can lead to cellular death and death generally. Drowning is another one of those examples. It's an outside force, you can't get air in. Both of these are, in fact, very dangerous, especially with children, especially unsupervised children at a pool or at, anywhere where they could be eating or at a pool, whoever knows. Both of them very dangerous. Maybe that's a video in the future that we should do. But we also have circulatory cause, another body system reaction to anoxia. We talk about ischemic strokes, where the blood is still flowing, but the clot is in a place that's preventing the blood flow from going to that place. And so that's what causes the ischemia is the blood is being blocked from going to those tissues, thus causing tissue death. Same kind of applies to hemorrhage, where the blood is flowing, but it's not going into the body. It's leaving the body or leaving the body vessel system. Think about intracranial hemorrhages. Not only does that add pressure, but it's also not delivering the oxygen to the needed tissues in the way that it needs. Same thing goes with massive hemorrhages. Maybe an artery is severed, which again can kill someone in a very short period of time. That's why in the military and in EMS, tourniquets are in fact very common now. They used to not very be common, but now they're extremely common to prevent that massive hemorrhage, the blood loss. Thus, you need the blood to go through the pipes and the heart to pump it as well. We can also mention embolism and thrombosis, both of which are kind of clots. And if there is something that prevents blood flow, that kind of ties back with ischemia. But all of these are a total deprivation of oxygen, the total absence of it. So, moving on, this is a list I compiled of possible anoxia and hypoxia, which could cause a brain injury. Think about choking. That's kind of obvious. If you cannot breathe, you're causing an oxygen deprivation. Stroke, we talk about that. Not the blood's flowing, it's just not getting to the tissues. Thus, the tissues are dying off. We see that commonly with stroke. Seizure. Now, why am I adding seizure to this list? Well, if you look at our seizure video, the recommended thing to do is to turn them on their side, because if you leave them on their back and they have frothing at the mouth, that can occlude the airway. That's another form of choking. It can be an airway obstruction. That's very bad. Also, asthma and COPD. Now, you might be thinking, what about asthma? Well, if you can't get the air out, you can't get the exchange to happen to where you get that oxygen to the blood to go to the tissues. And the same thing applies with COPD. And that's why it's important to have that rescue inhaler if you have those conditions. Drowning, another one that we've talked about. That one's very serious. Electrical shock. If you shock the heart, chances are it's not going to work. And so electrical shock can cause anoxia. Cardiac arrest, another form of, could be from electrical shock. It could be from ST elevation in the blood rhythm. It could be any number of things that cause the cardiac arrest, but the pump stops, the blood stops. Without that pump, the blood does not go. Opioids and drugs. What happens with those is that suppresses the respiratory system. So the breathing is slowed, if not maybe stopped in the extreme cases. You'll see that there are medications with some severe warnings saying, hey, be careful, do not mix with alcohol, do not operate heavy machinery. Especially medications that make you sleepy and drowsy will probably also slow your respiratory drive. Carbon monoxide is also another interesting one, because if you have a pulse oximeter, the thing that they stick on your finger in the hospitals that measures your oxygen rate, um, if you are in carbon monoxide poisoning, it will read normal because the carbon monoxide binds to the hemoglobin. Thus, it'll say, oh, yeah, you're normal, you're perfusing. But if it's carbon monoxide, it's because that's attaching to the blood, and that's bad. We don't want that. We want we want good oxygen. Also, heart failure. Maybe there's a failure in the vasculature where the blood can't get back up. Who knows what might that happen? What that might occur. Over medication. Maybe someone thought they forgot to take a medication. Maybe it slows their respiratory drive, or maybe it slows their heart rate to the point where there's no longer sufficient perfusion. This is also seen in opioids. It's also seen in antihistamines and also benzodiazepines, as well as a bunch of other medications. That's why it's important to take serious those medications on those pill boxes, on those pill bottles. We also got respiratory failure. Maybe this is tied with asthma, COPD, but maybe there's something wrong with the lungs. Maybe there's something wrong with the diaphragm. Pneumonia and infection kind of go together in this case because if you cannot breathe, either by pneumonia, tension pneumothorax, a hemothorax, or maybe an infection in your lungs, if you're not getting sufficient airflow, you could go into a state of hypoxia pretty quickly. Also, smoke inhalation. If you are a firefighter, or maybe you need the firefighters, that smoke inhalation is also bad for your lungs. It'll cause damage to your lungs, but also could cause you to be in a state of hypoxia or anoxia, both of which are bad. And how does this tie in with brain injury? Well, this image on the right here shows a control and a cardiac arrest survivor brain. Now, if we look at those images separately, we don't really see that much of a difference. But when we compare the two into section C of that, we start seeing the damage show up. This would have to be done by a trained eye, control versus the injury. And what we see is that there is, in fact, brain damage on the comparison between the two. And that is a legitimate brain injury. A heart attack, a cardiac arrest can be a brain injury, especially if they don't get that blood flowing and that oxygenation in sufficient time. The brain cells start to die. So, what does this lead me to conclude as a brain injury case manager? Well, the respiratory system is important to the body, but also brain function. Anoxia and hypoxia, as you saw in that list, those were some very common things. And yes, they're all very dangerous. They're dangerous to your brain, they're dangerous to the rest of your body as well. Some of those things are, in fact, very preventable. I think we should do an entire video on how to prevent some brain injuries. I think that would be a net good if we were able to prevent brain injuries. Not saying that I don't want to work with people with brain injuries. I think we should prevent them as we go. But breathing and brains matter. And you're probably wondering, what is this image I'm seeing on the right side of this screen? Well, I'm going to leave you with the resources, but let's think about this image real quick. This is a SPECT scan. This is a brain that has an obvious injury, and on the left side is a nice happy brain. On the right side, we have an unhappy brain that was a victim of hypoxia. So think about it. That tracer is going through the activity and you see some deficits there. Even though if you were to actually like scan the brain physically in person, that would look normal. And that's why hypoxia and anoxia are vitally important to learn. But with that being said, I think I will conclude it here. Those are my references. I hope everyone has a wonderful day. Don't forget, we'd appreciate it if you like, maybe subscribe to the channel. We put out this information every week, and we try to keep it educational, but also applicable. Also, we'd love to hear your comments and your feedback. Maybe there's something in here I missed. Maybe there's an anoxia I need to mention. We'd love to hear that in the comment section. But with that being said, I hope everyone has a wonderful rest of the day. Don't forget, protect your brains.